Good evening, everyone. Hi, I'm Kennedy Rees. And for my community health assessment video, we're going to be talking about Sevierville, Tennessee. This is a very small town in between Gatlinburg and Pigeon Forge, which are two very tourist attracted cities in East Tennessee. And I chose this community because this is where I grew up from the age of 7 to 18 when I joined the military. What is really interesting about this community is that LeConte Medical Center 2023 stated that a majority of the community was either under the age of 18 or over the age of 65. So there really wasn't much in between. Also, what was really interesting is that this is a very family oriented town. It really is. Even though we have a bunch of tourists come through, it is very family oriented. And Filipponi et al. 2022 established that the family dynamics and how children are raised in homes and what their relationship with their peers and their family members and how they interact and think about themselves impacts the way that they live. That includes how they physically, if they're physically active, their healthy eating habits or their eating habits in general. And that's one of the really big things is that community is very tight knit. Another interesting fact about Tennessee as a whole, it is actually in the top 10 most unhealthiest states in the United States. And that's also why I wanted to center around this as well. Especially my grand topic being anorexia nervosa and eating disorders as a whole. Now, what was really interesting about the top 10 concerns about Sevierville differ dramatically from what I expected them to be. So the first one was the lack of affordable housing, which we've seen across the US for a while. Substance use, this includes drugs and alcohol. Affordable health care, access to mental health care. Adult obesity, and that is to remind potentially how the family dynamic works around food and what's healthy. Skilled and work-related workforce, heart disease, stroke, high blood pressure have all become major health concerns. Lack of physical activity, youth nicotine use, youth obesity, and Sevierville actually had an 11th one, not just 10, and the 11th sadly was domestic violence. And I believe that it struggles because the South is very known for, one, their negative eating habits. We're known for everything being deep fried, coated in butter. That plays into the obesity, the heart disease, the lack of physical activity. Also, over the years, I've seen an increase in the number of children starting to use alcohol and nicotine early on. It was very common occurrence that you would see someone under the age of 16 having a drink or using cigarettes at the time that I was in high school. Now I'm sure it's moved to vapes. And domestic violence, I'm not too sure of the background on it, but I know that it has become a big issue, and that could be a part of the drug and alcohol abuse being so high on the list. From LeConte Medical Center 2023 established that substance use was number 2. I think the biggest mental health concern is the drug abuse and domestic violence. Even though we have the second highest and the 11th, I do believe that substance abuse and alcohol use are contributors to, one, the obesity, the physical ailments that come along with that, the encouragement of youth alcohol use and nicotine use. And substance use and alcohol use are huge contributors of domestic violence. It's a lot of dependency, and if we can address that situation early on, maybe we could drop domestic violence off of the list altogether. I do think that community health needs assessments are valuable. However, I think they are valuable if they're used correctly. I say that yes, we can have statistics all day about a community or about a town, but it doesn't mean a whole lot without there being action behind those words. And there needs to be a spread of not just 1 year and then 10 years later. There needs to be a comparison of, okay, how did we know this is where we started. We know that substance abuse, obesity, domestic violence are all on this list of 1 to 11. But where are we now, 5 to 6 years later? Okay, did we move substance use off of it? How much has gone down? Have the domestic violence cases gone down? And that's what we really need to see, is the comparison. Additionally, community health needs assessment are great if the resources are being supplied to the community in response to the needs assessment. If they're not, or if the resources have gone down or have not changed, I don't see the needs assessment moving forward very quickly or even at all. When I look at it too from a Christian perspective, it is important that the church acknowledges that there needs to be help, or people do need help outside of the church. Sometimes we do need medical intervention, we do need care. And by doing that, offering the counseling, the support, the opportunity to open the doors to those who are in need, especially for domestic violence, substance use. This could also include teaching about healthy eating, about understanding your resources, giving people a safe haven, and readdressing that God is on our side and that He's there to help us through it. That even though the resources may not be there at the time, understand that God will always be there, and His people, including the church, will always be there to help the best that they can. And this is where I really think that the needs assessment is going to be great, with the interaction with Sevier, with knowing that resources need to improve. And so that is my discussion on Sevierville, Tennessee. Thank you for joining me.